Everybody, my name is Kim Conchi. I'm the Chief Executive of Cornwall Chamber of Commerce. And in these weird times, and even weirder because I'm getting a horrible feedback on my computer. Hopefully that can be ironed out by the techies. So good afternoon. We at Cornwall Chamber of Commerce have been understandably concerned about the vagaries around the so-called Freedom Day yesterday. So we felt it appropriate on the 20th of July, when this podcast is being recorded, to work with the experts at Cornwall Council to get their views on how businesses, and indeed all of us, should conduct ourselves in these strange times, with the best chance of avoiding conflict and understanding the rules as we go forward. So I'm absolutely delighted this afternoon to welcome a team of experts from various aspects that have covered COVID minutely for Cornwall Council, to give businesses a clear as a path as possible to what they should be doing and what they can do over the next few days, and whether there's any projections for rules changing as we go into the future as well. So I'm very grateful for this, because British Chambers of Commerce, like other business groups, have been questioning government. And whilst obviously Chambers of Commerce are very much in favour of the private sector, it does seem very woolly around some of the guidelines at the moment coming from government, and that's where that has a possibility of causing people either unnecessary conflict or breaking the law. Then we thought we would take the opportunity to try and spread the news as far as wide. So I'm very grateful to Amy Glover for leading this from Cornwall Council's point of view, and we have a series of presentations this afternoon, and then there'll be plenty of time for Q&A afterwards. So I've got a few questions in advance, but do speak into the chat box, or put your questions in the chat box as we go along, or there will be the opportunity to raise a hand at the end afterwards. So we have a series of presentations which I'll let the experts themselves introduce themselves as we go through. So I'm delighted to start off with a presentation around the fundamental issue of COVID safety measures. So over to you, and thank you once again very much indeed for joining us and giving up your time this afternoon for the business community.
I've already made the schoolboy error of leaving myself on mute. Thank you very much, Kim, and delighted to be part of this event today, and just to have a chat to you regarding what COVID secure measures you as a business should have in place moving forwards. Now, I think we all know we've called it Freedom Day yesterday, and a lot of the legislation has actually left. You know, there's no requirements for social distancing, there's no requirements for servers seated. You know, we're going back to some of the old rules, but COVID is still here, and we're hearing time and time again that businesses are struggling. They're struggling to still keep staff, so people are coming down with COVID, others are isolating, and really and truly, both to look after your staff, to look after your customers, and for your own business continuity, you really do need to continue to manage COVID moving forwards. So we're into step 4. There's no legal limits on gatherings. There's no requirements for face coverings. Test your QR code. While we still recommend it's in place, it's not law for it to do so, but there are still laws around isolation. I'll touch on that in a moment. So we still should be, where we can, following the basic safe behaviours, and that, you know, the government are talking about taking personal responsibility. So the hands, keep washing those hands, keep sanitising. If you're going into an area where there's a lot of other people, where you can't social distance, you're with people you don't know, a face covering is still a really good idea. Space, if you're indoors, ventilation, that is vitally important. If you're working in an office with other people, open those windows. I mean, we've got lovely weather at the moment. Everybody's going to have the windows open. Everybody wants to be outside. But even as it gets a little bit colder, I prefer to see people in a coat with the windows open than the heating on and everything closed up. So, and again, we're going to talk about regular testing later on, and self-isolation if required. So what rules actually are in place? Well, perhaps we're going back towards more of the health and safety now. So you need to have a risk assessment. And if you employ 5 or more people, that risk assessment needs to be recorded. So risk assessment, COVID, what you've still got risks of transmission in your premises, of that between your staff, customers, and what controls can you put in place? And that is going back to the old rules. Is it appropriate to have social distancing? Is it appropriate for you not to have so many people in the business as you might have had at some time? I know there's quite a lot of businesses out there that are still 75, 80% capacity. And, you know, a lot of the customers are actually a lot happier if you can go into a shop or supermarket and there's still face coverings and they still feel protected. It's really important that we can get some regular lateral flow tests of staff, and I know a colleague of mine is going to talk a little bit more about that later. I've already mentioned about ventilation, so important. And think going forward, it's going to be around in the winter. Is it having an air conditioning system? Is it worth actually installing a new system into the building? Cleaning is still key. So wiping up those touch points where people are walking in and out the building, giving people the option of how to sanitise that, the ability to sanitise their hands as they come into the building. So if they're touching surfaces within your building, hopefully those are with clean hands. Good hygiene and sanitation, so that, you know, your staff have time to regularly wash hands. And also think about your staff. Do they come in as part of a car share? So if that's the case and one of them gets COVID, the other one will have to self-isolate. Are there ways around it? Staff room or meetings. You know, again, if you spend a lot of time together and one of those people come down with COVID, then it's likely the rest may have to isolate. So is there different ways you can do things to make sure that if one of your members of staff do pick up COVID, the rest of them are not going to be affected too easily? And, you know, there may be a lot less restrictions now, but we know actually at the moment the numbers are very high in Cornwall and they are continuing to rise. So it is a legitimate risk that you actually need to control. And make sure your staff understand those risks and you just keep them up to date. You know, it may not be that they're required to wear face coverings anymore, but a lot of businesses out there are still asking their staff to wear face coverings, and it's certainly something that we think is appropriate where you're in close contact with the general public or you're working closely with a lot of other members of staff. So what about the collection of contact details? These regulations have now been revoked from yesterday, and the policy actually remains in place in guidance. So what I would say to businesses is if you were collecting contact details prior to the 19th of July, so that would mainly be your hospitality, your close contact, your betting shops, your accommodation providers, we'd really ask you to carry on with what you were doing. So provide that QR code and provide an alternative means of taking those contact details if somebody's not got a phone. And again, that will really help us if there is an outbreak at your premises or if somebody comes in. You know, we're working very hard in the background. There's a big team of people following up the cases, making sure that we can identify where they've occurred, appropriate people are self-isolating, and that hopefully it doesn't spread too quickly. So it's really important that contact details, although no longer required in law, if you have been doing it, please continue to do it. So I also want to just quickly touch on cases in the workplace and when isolation is required. So if you've got somebody that's worked, a member of your staff, and they've rung you up and said, look, I've just taken a PCR test, it's come back positive. Test and Trace are probably likely to be in contact with you at some time, but it's really good if you can take the initiative and identify what are close contacts in your business and get them to isolate straight away, because it will give you a head start and hopefully making sure it doesn't spread within your business. Those that could be affected are out of your business and that you can continue running. So when we're considering who are close contacts, how do we identify them? So if Sam Smith, name out the bag, was tested positive today, but the last time she was in work was yesterday, what we're looking at is 48 hours before the positive test, or before she first became symptomatic. Anytime she was at work within those 48 hours, you need to identify close contacts. And a close contact is somebody that's had face-to-face contact with a case less than 1 metre away, being within 1 metre of a case for 1 minute or longer without face-to-face contact, or being within 2 metres of a case for more than 15 minutes, either as a one-off or added together over the day. So if somebody's working quite closely with somebody, you know, in a warehouse environment, maybe lifting or moving things, or you know, in a shared office space right next door to each other, they are likely to be a close contact, and they should then go and isolate for 10 days, or 10 days, the 10 days starts counting from when they were last in contact for that positive person. So that's really important. And at the moment, you know, we get some businesses that say, well, can I lateral flow test? Can that member of staff take lateral flow tests every morning and come into work? As the rules are at the moment, that is not allowed. If they are asked to self-isolate, either through workplace exposure or through other exposure, they should self-isolate at home with no lateral flow tests. I know the government are talking about changing the rules, and that might happen next month, but the rules as they are today is that self-isolation, you cannot test yourself out of it. You probably can't actually read that, but I expect we'll be sending, I'm presuming we're sending out slides to everybody that's attended today. And that just literally is quite a useful little flow chart just to identify what close contacts you've had in the business and whether they should be self-isolating or not. Right, I'm going to hand over to my colleague who's going to talk to you about testing for COVID-19.
Oh, there we go, hang on. Sorry about that. Hello everyone, I'm Caroline Court. I'm one of the public health consultants at Cornwall Council. So yes, testing. Now that's quite straightforward really. There's only 2 tests that are in general use. So the first one is the PCR test. So what is it? It's the gold standard test. It needs to be sent off to a laboratory. So it takes a day or 2 to get the result back. We use it for people with COVID symptoms. It can also be used for a contact of a case, but as Sarah James just said, you can't test your way out of being a contact. So although you may be advised to get a test, if you're a close contact, you still have to continue with that 10-day isolation, even if your test comes back negative. And then the other scenario when you use it is if you have a positive lateral flow test, which I'll come on to in a second. And how you get those, you book them through the government portal, and that gives you the option that you can either go to a test centre, hence the picture, and there are 12 test sites around Cornwall, or you can have a test sent to your home. Going to a test site, you will get the result back quicker. So then moving on to the other test is the lateral flow test. Now this is often abbreviated to LFT, so lateral flow test, or LFD, lateral flow device, so it can be a bit confusing, but that's all lateral flow. So this is the rapid home test. You get results within 30 minutes. We recommend that these are used twice weekly, and the important thing is it's for people without symptoms. They should never be used for anyone with symptoms. If you have symptoms, you should have a PCR test. Some people are using them more often than twice weekly. Our recommendation is that it is twice weekly, but if there is an outbreak, high number of cases in a particular setting, it's a reasonable approach to go for daily testing for say a week, just to identify if there are any additional cases, because obviously you'll then pick them up more quickly and they'll be less likely to come into the workplace and spread the virus around. And how do you get hold of these? Well, these come in boxes of 7. You can go to your local pharmacy and collect 2 boxes per person. You can order them online, or now you can get them from Cornwall Council, which Amy will talk about. The only thing to say, of course, about both of these tests is they are completely free. So right, I'll hand over to Amy. Thank you.
Thank you, Caroline. So I want to talk a little bit more about lateral flow testing for businesses. And I think I thought the title sort of summed it all up really. The bottom line is please don't stop. So why continue to lateral flow test? So you know that twice weekly rapid lateral flow testing is a key tool to keeping your business as COVID free and as COVID safe as possible. And alongside the vaccine rollout, which is obviously picking up really good pace now, and fresh air, regular testing using the lateral flow device does still remain at the heart of breaking the chains of transmission. What may not be quite so widely known is that the twice weekly testing also helps to suppress and control the spread of variants. So even moving forward, you know, COVID and potential variants are going to be with us for a long time. So the twice weekly testing is going to keep us a step ahead of the game. And it's a vital tool in helping us to identify asymptomatic cases, which for business owners basically means that you can pluck out those individual members of staff who are asymptomatic before it becomes a wider issue for your business and your business continuity. I think we also need to be mindful that there are still people who've not received both of their vaccinations, particularly in the hospitality sectors where you've got younger workers. We all need to really play a part in both protecting those not double vaccinated, but everybody who are coming down to Cornwall over the holiday period, and try and keep everybody as safe as we can. And although the government doesn't require people to lateral flow test, the advice is still to continue with all of your infection control measures. And you've all invested so much in infection control measures over recent months. It would be great if the lateral flow test and those continued over the coming months. So how can we support your business? So we've started a programme which is aimed at delivering these lateral flow tests to any business with a front-facing role in tourism. And what we can do is supply businesses with 7 weeks of twice weekly testing. They're the same packs that you would get from a pharmacy. So it's a pack of 7 tests. So that's each pack is 3.5 weeks worth of tests. And we will continue to do that until the end of September for any business that approaches us. The reason why we've started doing this is that we know that businesses are asking their staff to go and get packs from pharmacies or order them online. But the reality is that we know that staff aren't doing this, and it may just be that they keep putting it off. You know, I'll go to the pharmacy tomorrow. Oh, I forgot to do that today. Whatever the reason is, it's not happening enough in the workplace, and we need to try and support you in firming up that from a business continuity perspective. So we're offering the test to make it as easy as possible for you to ensure your staff are testing. And that does mean you taking a little bit of responsibility by basically coming to us, asking for the tests. And we're asking that you put just a little layer of management in there by basically giving each of your staff 1 pack at a time. And that's encouraging them to have to reapproach you after 3.5 weeks to ask for the next pack. And the hope is that that might just stimulate people to test a bit more regularly. A, because you've handed them the pack rather than them having to go and get it, and B, because they know you're going to be asking how they're getting on and are they ready for the next pack 3.5 weeks later. What we really want to do is be proactive in reducing risk rather than being reactive when the risk reaches your business. And of course, we'll support you when the risk reaches you. But if we can do anything to stop that happening, that's really what our ambition is over the coming weeks. So, and the prize is, what you will get if you join us on this journey is a scheme that we've launched called the STAR Business. So we've named it, you know, staff testing available regularly. It's what the STAR stands for. The scheme is being launched this week. And what we're going to do is offer you a poster that will be brightly coloured that you can display at your business premises, particularly again for restaurants, hotels. We're thinking that might just reassure staff and customers that you're continuing to do your very best to keep COVID-19 at bay. And we will also put your name on the Cornwall Council on our website under our testing page as a participator in the scheme. So if you would like to get on board, if you want any more information about lateral flows and how we can support them in your business, please either telephone us or drop me an email, and we will certainly support you over the coming weeks in your business setting. I think, Caroline, are you next?
Is that back to me?
Let's see what's coming next. Hang on.
Vaccinations, I think.
Yeah, that's me. You're right.
Okay.
That's me. Apologies. This was meant to be my colleague Whitney Curry, but she's unable to make it today, so I'll just run through this one with you.
Thank you.
Okay, so firstly, why are COVID vaccines important? I mean, this whole concept around herd immunity, that if you get enough of the population that are immune, either through vaccination or through having the infection, you will stop the virus just circulating around and continuing to get more and more cases and potentially more and more variants as well. So getting the second dose is really important. This is going to give additional protection. It's going to give protection that will last longer, certainly for months, probably for years. There's very strong evidence that vaccines are working. You get a substantial reduction in severe disease, hospitalizations and deaths. There's also reduction in transmission. The numbers are looking currently like the risk of, once you're double vaccinated, your risk of catching coronavirus is halved, and then if you catch it, your risk of passing it on is halved. So half of a half. Overall, it's a 75% reduction in transmission in people who are vaccinated. So that's really very impressive, and it's very clear that the benefits outweigh the risks. That's for disease, for hospitalisation, for death, but also for long COVID, which is something that we really don't know enough about yet, but could have ramifications for years, months and years to come. So this is a Swiss cheese model, which is quite nice, and this is just showing all the different layers. I don't know if you can read all those, but all the different layers of protection against coronavirus, ranging from social distancing and masks right through to isolation and vaccines. And the whole point is that none of these layers individually are enough, because they've all got their imperfections, they've all got their holes in them. But if you put them all together, you've got enough to stop coronavirus circulating. But as you see, as we're starting to take out some of those layers with the changes, with the level 4 changes, then vaccines are going to become, and isolation are going to become even more important going forward. So the vaccination model is a mixed delivery model. So we have PCN delivery, that's the primary care network. So that's local general practices doing vaccination, also some pharmacies, and then the mass vaccination centres at Stithians and at the showground in Weybridge. And there's also one in Plymouth for people in East Cornwall. And all the information is available on the NHS Kerno website, and some of these are walk-ins which are advertised, so you don't even need to book, you can turn up for your vaccine. How are we getting on? Well, it's looking pretty good. I think we're quite pleased with the results so far, as in 85% have had a first dose now, those who are eligible, and nearly 68% have had second dose. Really good uptake in the over 50s. Need a bit more work to get the under 50s levels up. As each age group goes down, each age group is younger, of course. At the moment, there's lower rates, but you'd expect that, because I mean the youngest age groups have only just recently become eligible. Okay, I think that's me done. Yeah, I'm handing over to Richard.
Thanks, Caroline. Good afternoon, all. My name is Richard Sharp. I'm also from the public health team. I lead our mental health programme, and part of the response to the pandemic, we established a system level joint-led mental health suicide prevention cell to mitigate the impacts of the pandemic across 3 areas: the population wellbeing, workforce wellbeing, and pathways to services, so healthcare services, for example. And one of the concerns that's been rolling throughout the pandemic is the impact on businesses and workforce, and particularly at the moment where you're experiencing changes to legislation, as we just heard, but also the potential yo-yoing effect between opening and closing businesses due to staff testing positive. So we're currently working on this area and looking at different measures and programs that might help mitigate those risks and impacts on your staff. And this is important. So we've been working with Healthwatch, looking at levels of anxiety and depression in our communities. And that's kind of indicating around about a doubling of levels of anxiety and depression. And this is from, for example, in 2017, anxiety, depression, or probable anxiety and depression was around about 5% of the population. And we're now up to around about between 13 and 15% of the population. Those are online surveys, so they're biased in their own ways, but it just gives you an indication of the impact of mental health. Typical risk factors that came up in that work were around people being furloughed, people working from home, those feeling isolated, so away from team members, for example, but also family and friends, and the ongoing impact of opening and closures of businesses. This may be compounded by a loss of support within somebody's social network, social isolation, as I just mentioned, but also increasing complexity and issues around housing stability and financial precarity. So things like loss of income, or as a business closes and then reopens again. Typical populations at risk include young adults in the workforce, those with a disability or long-term condition, sensory impairment, and people who have identified themselves as being gay, bisexual, pansexual, asexual, or other. So those are some of the high-risk groups that we've been looking at. It's worth keeping in mind in terms of your businesses going forward. And in terms of support available, we have something we're promoting widely. It's called a Z card. And if you want copies, then please contact us and let us know the numbers and the delivery address. But these are really, they're wallet size, and they're available to have a conversation with somebody to remind them of things like 5 ways to wellbeing, which is about connecting to people, being physically active, learning new skills, giving to others. So it doesn't have to be necessarily around financial reward, but could be volunteering, for example, and then taking notice of your environment. And then that card will then act as a prompt, if you like, of where to go to get help and support with your mental wellbeing. Online, we have, and the links are in the slides, we have a range of mental health and wellbeing guidance information. So one is around psychological wellbeing. This links you to, for example, Outlook Southwest. So their talking therapies and CBT online support program. Also some guides around returning to work and then working from home. There's a whole host of other guidance and guides available. So whether you've got a mental health illness or OCD, for example. And another thing we've been promoting widely is the accessibility of a 24/7 mental health response line, and that will help individuals with their mental wellbeing and signpost them to the appropriate level of support. We've also got a number of different interventions in place, and I just picked a couple of examples. So the MEND project, which is mental health, employment needs and debt advice. And this has been established to support people with their lifestyle risk factors, things like employment, housing, debt, but also a mental health support package. And that's been available, and that contract goes up to the end of March next year. We also have a program with Healthy Cornwall known as virtual lifestyle assessments. And this is kind of like a virtual health check. So they'll run through a series of physical health questions, but also mental health screening and supporting an individual with signposting. At this point, I'll just pass on to my colleague Paula, who's going to talk a little bit about the safety plans we have in place and some of the mental health training programs we have in place as well.
Yeah, thanks, Richard. Hi, my name's Paula Chappell. I'm a public health practitioner with the team, and my work is focused mainly around mental health and suicide prevention particularly. And so in terms of workplaces, there are a number of things that we're recommending that might be really good things to just have a little think about as workplaces are opening back up again, some of which will have been open all the way through, but for those of you who are thinking about work opening back up again and the anxieties that might start to provoke for some people, and thinking about how you can create a culture of supportive a support around people's mental health, to encourage them to be able to talk about if they're feeling a little bit unsure, a little bit anxious about being back in the workplace, and the support that might be available that you can offer for them, or that might be available within the wider community. Here in Cornwall, our rates of suicide, our data around suicide tells us that around a third of people who die have not sought support from any services, and so what that means for us is that we are trying to encourage as much of our community, and that's workplaces as well, to engage in some kind of training around mental health and suicide prevention, so that there are more people on the ground who are able and open and willing to have those conversations around mental health. So that it does build that culture, and so there are more people that you can kind of bump into in your ordinary work day that have good listening skills and have an understanding of where to support. So using perhaps the Z cards that Rich mentioned to signpost people to further support when they need it. But there's a full programme of mental health and suicide prevention training that's available, and we are about to launch a scheme shortly that will help to identify those people who've been trained, so that they are more visible in our community, so that we can we know who has had that training and who is okay for having those conversations, as it can be quite difficult to have those conversations around suicide prevention, particularly if it's a little bit of a sensitive area. There are lots of people who have been affected in some way by suicide, so it would be really quite a helpful scheme to have that visual notification almost that there are people willing to have conversations who are open to that. So lots of training available, and we've got some more support links that we can send with this, but it's also available on the Healthy Cornwall website. But they're starting from sort of 20-minute online e-learning that you can do in your own time, right up to two full days of intense training face to face. So there's various levels available for whatever your needs might be. And also then thinking about the mental health safety plans that are also listed on there as well. They're a tool to support people with their mental health. So they're a kind of way of recognising the things that help to keep you well, but also the things that help to make you feel not so well. And so you might need to try your best to avoid those, or to recognise if they're unavoidable, what are the other things that you might be able to do that that can help to sort of mitigate the risks that come with that, and who are the support people, and what are the things that help you, maybe getting out in nature, or knowing that you've got a support worker, that you've got their phone number on hand, so that kind of thing. So mental health safety plans are something that anyone at all can make, and we've got a page on the Cornwall Council website that's got a lot more information about what they are, how they work and why they work, and how you could create one for yourself or support someone else to create one. And then I think that just the last thing I wanted to mention on there really was about the mental health at work website, and also the Healthy Cornwall workplace website. There's lots of resources that can help you to support your staff around their mental health. If you're thinking about, this is something I know we need to do, but I don't really know where to start, they're a really good place to take a look, and it gives you a bit of a framework to work towards, and just thinking about how you can start to create that culture of being open and having those conversations, and thinking about individuals on their own level about what they might need in order to get back in the workplace. That's it for me.
Well, thank you very much, all of you, Paula, Richard, Caroline, Amy and Sarah Jane. That's been incredibly informative. Thank you. If I can just start at the tail end there, Paula and Richard. Cornwall Chamber of Commerce takes wellbeing in the workplace incredibly importantly. We've sort of got 4 policies which we've started with to try and influence interaction between the private sector and the public sector, and one of them is wellbeing in the workplace. workplace, and my colleague Naomi, who I think is on the line today, is our wellbeing lead at the Chamber. So we've deliberately called that version 1.0 so that we can work with you experts to make sure it's a living, breathing, developing document as we go along. So some of those Z cards for us as we open up to events and things again would be very useful for us to have ourselves, but also to distribute for Naomi and our board director Laura, who took a lead on it, to be able to distribute to businesses as events come back to place, and we can we're getting them in the hands of more and more businesses again. So thank you. That was incredibly informative. I from my own perspective, I think that because business owners tend to be quite civic-minded citizens, they can sort of gold plate the layers of regulations or guidelines that you've suggested this afternoon. So we had a case last week where a young person who had been single vaccinated, tested positive on a lateral flow test. Nobody came into contact with her on the crossing the guidelines that you've said. Everybody was more than 2 meters away and was less than 15 minutes. But there's a feeling that we should still take the isolation measures. Of course, I know you'll say that's good to err on the side of caution, but are we in danger of stymieing ourselves for longer than we need to by being overcautious at business owner level, or would you say that's the right state of mind to have? I think it was in your presentation, Amy, I think that the 2 meter or 1 meter or car share regulations were discussed.
I think Sarah or Caroline would probably be better placed to answer that one. It was Sarah's presentation.
Yeah, it came over in mine.
Sorry, it was yours, Sarah, yes.
Yeah, it's a really hard balance to come to, really. I think what we're very keen to do is actually to support businesses stay open where they can. So if they have really good COVID control measures in place, if their staff are wearing face coverings, they are socially distancing within the workplace, then it can be viable for them to keep going and those staff not needing to isolate. What I would say, though, is we found very much with this latest Delta variant, it's very transmissible. So even if people are social distancing, but in an indoor area that's not particularly well ventilated, we have found that staff members have been picking it up, perhaps where we've not expected them to. And therefore, by some businesses literally just taking, everybody's going to isolate for 10 days, they do make sure they stop it dead, rather than worrying 3 or 4 days that somebody else is going to test positive and keep trickling along. But ultimately, it's the business decision every time to work out what works for their business. And if they have really good procedures in place and want to keep opening because they haven't got close contact, we would support them to do so.
Okay, thank you very much indeed. Next question I have is, we have taken a lot of precautions over the last few years to have well-being in the workplace, meaning the place where we gather to go to work looked after. We've got defibrillators and first aid trained people. What are the regulations or guidelines covering people working at home? A business I know had a case where somebody was working at home. The employee, thought he was having a heart attack. Fortunately, his partner was at home that day and rushed him to Trelisk, and it was nothing. But I just wonder, are there things that the employee can do, and what are the legal requirements of an employer if somebody gets ill at home, where rightly or wrongly, the working conditions are not monitored as closely. The seat, the breaks from the computer screen, the taking a break at lunchtime, these sort of things are not able to be controlled quite as well if somebody's working remotely. Are there any sort of precedents, test cases about what the employer's responsibility is in those cases for home workers?
Shall I pick this up first again, although I expect one of my colleagues might come back in. I mean, we're very much in the health and safety field here. So if you have an employee and they're working at home as part of their working pattern, or they're doing it at your request or during COVID, there are health and safety duties for that employee. Now, it partly comes down to risk assessment. So in the case you mentioned, if the person that was taken off to hospital had no history of any illness or anything like that, it's not a requirement for the business to sort of be monitoring them every hour and, you know, almost having a lone working policy. But equally, if somebody was subject to some sort of attacks or some sort of illness and they were working alone, then they might put some sort of check-in policy in place. Certainly employers should be looking at things like that they've got appropriate IT facilities at home, they've got appropriate you know, they have a comfortable working environment, suitable chair, and it might be for that employee to provide certain things, so an extra screen for somebody to work from home, potentially a telephone line, a chair, tables. And again, we all at the beginning of COVID went, well, it's just going to be a temporary measure, everybody's going to be at home for a month or two, you know, we'll all manage, to a lot of people have been 18 months at home, and a lot of working practices have now changed that I don't think there's a lot of staff that are going to stay to a majority pattern of working at home, and therefore the employer has got a health and safety duty. I know certainly in Cornwall Council we have to fill out a risk assessment for working at home. We have to identify if we have any specific needs around IT, around health or anything like that. And also you can get certain software in place that does actually make a employee have a break for a certain amount of time or things like that. So there's lots of tools there, but I think it goes back to that really good communication between the employee and the employer to make sure that they're comfortable and happy, and that they're not doing stupid amounts of work.
Yeah. Okay. Thank you. Thank you. You mentioned, back to you, Sarah. You mentioned about employers of over 5 people needed to do a risk assessment around COVID. And Jessica asks in the chat box, do you need to? Is there a sort of a sign online on the company's website or wherever that you need to display that you've done that COVID-19 risk assessment?
No, initially the government asked for people that employed more than 50 people that they shared it. I think going forward now, the main thing to do is just talk to your staff and make sure you've picked up the risks that they're exposed to. And also, you know, very much going back to what Richard was talking about, their mental health. A lot of people are going back to work and they're still quite worried about it, particularly the older generation, the more vulnerable people. It's really important that, you know, you communicate with your staff what precautions you've got in place, and if they've got any concerns, they can feel open to come and talk to you about them. So hopefully you're coming back to a confident workforce that feel that they're being looked after.
Thank you. That's good. And Kevin, I know another of your colleagues has posted the town centre's welcome symbol there, which we can look out for and businesses can get hold of from you, Kevin. I presume it's faded in the chat box there. Last question I had in advance, I suppose a bit more topical, was have you got any data from yesterday? Have things got noticeably either worse from a case point of view? I suppose it's too early to tell, or have you heard from any businesses or customers or interactions yesterday that lead us to believe that Freedom Day, so-called, is leading to any better or worse interactions than before? Has anybody got any data from yesterday?
I can just start by saying that we don't have any data in terms of cases. It's a bit, ask us again at the end of this week and we might have a better idea whether it's made any difference.
Okay, we'll keep in touch, definitely. Okay. Jessica asked another question which has come in. Can you enforce the wearing a face covering for staff? So this is specifically not customers, which I know is another fraught area, but for your staff, if you're in, let's envisage for a moment a retail premises. Can you force your staff to wear face covering all day?
I'll pick this one up again. No is the honest answer. You can ask your staff to wear a face covering. We've had some feedback from the Health and Safety Executive, HSE, and because a face covering is not considered to be PPE, you cannot then therefore ask your staff to use it. So if, for example, you're in a medical setting and we were asking staff to wear a type 2 face mask or something like that, that would be compulsory, providing there was no medical exemption. But in a retail environment, we would hope that all the staff would understand that it's for everybody's good and that part of the risk assessment, but because it's not PPE, you cannot actually technically enforce it.
Thank you. Is there any other hands raised? I can't see any. Have there, back to you, the expert team, have there been any drifts that your sensitivities have gone from these sort of questions around what businesses are worrying about? Is there anything you think you need to re-emphasize or not? And if not, then at the moment, Amy, when do you expect sort of further updates, and when might we, if we've set this group up as a group, we might as well keep it going. When do you expect developments? What's your inside track info on what the roadmap is from here?
I don't think any of us know quite what the roadmap holds at the moment. I think the one thing that I would say to take away is that from a business perspective, please try and change as little as you possibly can moving forwards. Everything that you've worked so hard to sort out and maintain in your business to keep everybody safe, the more of that you can continue to do, the safer you'll all be. And yes, Kim, more than happy to repeat this whenever people see fit, and just keep you updated and informed of where the roadmap is going when we know.
Thank you.
The only thing we could add to that is that we do know there's going to be changes on August the 16th. We don't know the details of it yet, but that's when I said earlier about you, or we both, a couple of us said about not being able to test your way out of being a contact. It seems that may be changing, but we need to wait to see the final details on that. Okay. And there was a question also about there being a video around LFTs. There is a video. I can't remember where it is, but we'll dig out the link and send it on, because I agree the instructions aren't great, and there's a very good video that shows people how to do it.
I thought I was just being dim. I'm surprised that I'm glad other people are finding that as well. Yeah, not now, but I mean the first time it was quite fiddly, wasn't it, really? But we're all getting used to that, I suppose, like everything else now. But yes, if there are younger colleagues who haven't done that before, then I guess that would be very, very useful, Matt. Thank you for that question. And then Toby's got a question there. These are employers, both of these people now. COVID passports. Any insight into whether they're going to make a legal appearance or anything?
Yeah, I'm not sure about the legal status of it. Sarah Jane, you're probably better to answer than me. I'll let you answer.
I think there is likely to be. I mean, certainly the government have announced that there will be a requirement to be double vaccinated if you're going into nightclubs later on. So that is likely to be what you see as a COVID passport. But at the moment, the government haven't produced any guidance relating to it, because they've talked about events having the option of using COVID passports, but they haven't actually said how these can be issued, what sort of form they will be in, because there's sort of several areas that could make you exempt. So it could be that you've had COVID within the last 3 months. It could be that you're double vaccinated. It could be that you're under 18. So there's several ways. Like many things in this whole pandemic, it moves so quickly that often we get hints of what's to come, but we haven't actually seen it in black and white yet.
Interesting. I was reading about the care sector, and that the UK government have temporarily voted against compulsory testing for care workers, whereas France, they apparently are not going to be paid after September unless they're double jabbed. Is that a thing which any of you have a view on, or is that do you just go with the legal things, or can I push any of you on what that might would that be a good thing?
Should I answer that one? I think it's a difficult one, really. The only parallel that's been brought, I mean, I certainly, when I was practicing, I had to have hepatitis vaccination, and doctors never used to question that. It was just expected of us. I think it would be really hard going forward if we continue to get outbreaks in care homes, because it's, you know, what seems to be the case at the moment is that it is the staff rather than visitors or anything else that seems to be bringing it in. So, you know, it's a tough one, and I don't have a definite view, but I think if you were to push me, I'd probably say that what we do is we just strongly recommend it at the moment.
Yeah. Now, my wife's a dentist, and she's, you know, forever had to have hepatitis and so on to practice, and never questioned it. So it probably needs to be just introduced to those starting, and that it doesn't become, they don't see it as an issue, perhaps. But it did seem a strange battle to fight, that one, for me, when there's plenty of other things that it could be worrying about. Right, 2 more questions, and then we must close. So there's 2 more in the chat bar there. From Debbie, is there any guidance on mechanical ventilation in offices? Is there any equipment you recommend to do what you were saying, Sarah Jane, about keeping the windows open? Is there some mechanical ventilation that can do the same job in closed offices?
Yes, there is. What I will do is I'll pop in the chat box in a minute the link to the HSE website, which has got some information regarding ventilation and what you should consider within your workplace. What you're looking at when you're ventilating, if you're doing some sort of ventilation that's not natural, you need to make sure that you're not recirculating the air you've got in the building, but you're bringing fresh air into the building rather than recirculation. So that's the main thing to think about when you've got any ventilation system, that you're bringing fresh air in. And then the quicker the exchange of that fresh air, the better. So, you know, if it's bringing fresh air in, you know, a very quick rate and turning over what's inside the building, the quicker the better.
Okay, that's a very clear message, and thank you for that. I hope that answers that, Debbie, because that is clear that it's got to be some drawing air from outside to have any impact, really. And finally, Mark, I'll just read that out. Do you envisage issues in future with staff who refuse to be vaccinated, especially those who are customer facing? Well, I suppose, Caroline, that's back to the point of, you know, if we can't enforce it in the care sector, then it's going to be difficult elsewhere. But you know, it's a difficult one, isn't it? I mean, where does the law, you know, what role the law here, what role the employer, and what role the right of the individual? It's quite a complex and philosophical, and a topic for another meeting over a glass of wine, that one, I think. Socially distanced.
Right.
Anything to add to that? I mean, it is no, it's
not really. And I suppose the other question is, you know, it's a bit like, you know, when you employ new staff, can you put different rules onto new staff than in your existing staff? So therefore, can you say in the future, well, I would ask someone at interview whether they had vaccination? I don't think even that's clear at the moment.
No, that's an interesting one, isn't it? Yes, we've recruited at the Chamber of Commerce during the pandemic, but it was 4 young people who most of the recruits were, you know, before there was any requirement for them to be things. So that question didn't come up, but you know, it would be seen by some sort of freedom of speech people as intrusive as what's your age, or you know, any other questions that we no longer ask at interviews. For other people, as you say, Caroline, if you're entering a health environment, you'd think it was a fundamental requirement, but then that's only my take on it at the moment. So some further questions to be had, and I can see this getting very philosophical in future meetings around this. Mark, is that a hand up, another one, or?
Sorry, yeah, is a hand up, Kim. One is an apologies. I was caught in a phone call, so I've joined the meeting late. I'm from Coastline Housing. I put that question in really out of interest because obviously we've got a lot of staff who are customer facing, and I just wondered how it would work in the future with some of our customers living on our properties. If they ask the question, say to a surveyor visiting the property, have you been vaccinated, won't let them in. You know, so it's not so much just as us enforcing it on our employees, but is it going to cause problems from general public refusing us to come into a property because our surveyor hasn't had you know, double vaccinated. And I know it's something, as we say, you can't really enforce, so it's a bit of a minefield. But it was just one I'd raised, and like I say, apologies for joining the meeting late.
No, well, you've opened as I say, a deep and prolonged philosophical discussion. So we'll have to come back. But a Coastline, I mean, that is, you know, for example, Coastline Housing has been partner to the Smart Line project, testing people's sort of health in their home for 4 years now. So you'd think this would be a legitimate extension to that, and they'd be well within their rights to say, well, you know, you could be adversely affecting my health in my home setting rather than the work setting, their home, rather than the surveyor's going about his work or her work. Yeah. It's a tricky one, that, isn't it?
Yeah, it certainly is.
Because it is that is their home, although the person coming in is doing their work. The person in the house is his or her home. Interesting one. Looks like some future guides did. Well, I know that most people have these meetings, and then another one starts relentlessly at the top of the hour. So I'll give everybody 2 minutes or whatever it is, 3 minutes break. So thank you again, everybody. Paula, Richard, Amy, Caroline, Sarah Jane, and Kev as well for the comments in the chat box. It's been really insightful. As I say, I think the start of a process, by the sound of it, and we'll just work with each other as you know, these things unfold, to make sure that employers who, you know, do 99.9% of the time want to do the right things are given the guidance by you, and that you get a few of the questions asked from business owners like today back to you, just to give a steer on what business owners are concerned about. And you know, it is still very worrying times in Cornwall, and sadly, with the isolation being such a big issue at the moment, it is constraining the ability of many businesses to bounce back from 16 months of really tough time. So it's a shame. So I know that business owners will, you know, their proclivity will be towards getting it out of the way as quickly as possible. But this sort of insight from you is very, very important. So thank you all very much indeed. Thank you for dedicating the time this afternoon.
Well, thank you for your time, and thanks, Kim and Naomi, for organising it. That was great.
And thanks for attending, everybody. I hope you can pass it on, and do let the team know if you need Z cards or any other information, particularly around those health issues that Paula and Richard presented. Thanks very much, everybody. Cheerio.
Thanks a lot. Bye-bye.
Bye.